Hi, I'm Dr. Smrithi Nayak. I'm a fertility specialist and laparoscopic surgeon at Aster RV Hospital in JP Nagar, Bangalore. Today I'll be talking to you about intrauterine insemination, which is a very common fertility treatment in many fertility centers. There are a lot of myths which go around with this procedure. So here today I will be clarifying few of the misconceptions that go with IUI. Misconception number one is that IUI and IVF are the same. So IUI and IVF are two very different procedures. Okay, IUI is a procedure in which we stimulate the patient and make multifollicular development happen, and at the right time when the ovulation has taken place, we ask the husband to give a sample of semen, we process it and then we inject it into the uterus so that the oocyte and the sperm meet inside the fallopian tube. IVF on the other hand is a completely different process where the patient is stimulated, the eggs are retrieved through a process called oocyte retrieval, and then the sperms are taken and injected into these oocytes outside the body of the patient. The fertilization takes place outside the body, and once the embryos reach a stage of day 5, then they are slowly injected into the uterus. So IUI is comparatively less expensive, so the success rates are also less compared to an IVF. Success rates of IUI range anywhere from 10 to 15%, whereas that of IVF is 50 to 60%. Myth number 2, IUI is perceived as a very painful process. Now again, this is a very simple procedure in which the patient is asked to empty the bladder and patient is asked to lie down on a comfortable cot in a lithotomy position. Once the cervix is visualized using a speculum, a small catheter, which is almost the size of a pen refill, is taken and the sample is loaded inside this catheter. Then the sample is injected slowly into the uterus, and the patient's comfort is of course taken care of by not injecting it very fast. After the slow insertion of the sample, the patient is continued to made to be lie down for at least 20 minutes. And then she is made to wake up, and the next process of medications is given to the patient. So definitely IUI does not cause any sort of pain. It is a minimally invasive procedure which may cause very temporary pain just when the insertion is happening. Misconception number 3 is a lot of my patients wonder why the first time it did not work out, because they think that IUI has a very good success rate. Mind you, the success of an IUI depends on multiple factors, which includes the most important factor, that is the quality of the oocyte as well as the quality of the sperm. So when the sperms are injected into the uterus, it overcomes certain cervical factors of infertility, but at the same time these sperms have to go and penetrate into the oocyte and cause fertilization, which are microscopic events which cannot be really detected. So IUI actually has a success rate of around 10 to 15%, and studies show that multiple cycles of IUI yield better success rates rather than just the first cycle. So if the first cycle is not successful, please don't be disheartened and keep trying for the IUI in the second as well as the third cycle as well. Myth number 4 is a lot of people think IUI leads to multiple pregnancies and twin gestations. Again, here it depends on how many follicles are developed and how many follicles actually ovulate. Again, the very important criteria, which is the quality of the eggs, plays a very important role in understanding how many get fertilized, how many lead to a pregnancy. So that myth that IUI will always lead to multiple pregnancy is wrong. So please make sure that you get all this information right and get your advice on in your fertility journey with us at Aster RV. We, the OBG team here, are more than happy to answer any of your queries and help all the mothers out there to conceive and have the baby of their dreams. Thank you.